the number one dermatologic diagnosis for African Americans, when they see a dermatologist, the number one diagnosis that they code, with Medicare, Medicaid, acne, right? The number two diagnosis is unspecified dermatitis, which I chuckle at because that basically means they don't know what it was. So like the
It's
number
just,
one thing
yeah.
in white Americans is actinic keratosis, there's acne, there's skin cancer. But the number two thing for Black patients is an unspecified dermatitis, which why don't people do better with Black skin?
That's such a great question because it's something that's even shocking for me to hear. But even in the dermatology world, having skin of color or darker skin can make some diagnoses slightly more challenging. So, and your question is, why is that? Well, one of the reasons why is there's so many reasons why, but one of the reasons why is the pigment in the skin can sometimes mask redness. So it's not as obvious, as clear what the diagnosis is. If someone is darkly pigmented, you might not see as much characteristic redness. So sometimes in dermatology, things will be described as having a red color or an orange color. But in skin of color, it would be like maybe more dark brown, red brown, even purple hued, because the constitutive pigment can mask the redness or the traditional way we are taught how to diagnose skin conditions.
So how important is it for people with skin of color to see a dermatologist with skin of color?
I think it's very important to see a dermatologist with skin of color or someone who has an interest in treating skin of color patients, because I have a lot of colleagues who may not have skin of color, but practice in an environment where they're extremely well versed and extremely well trained on skin of color dermatology. So, people who, let's say, do their residencies in Miami or New York City or in places that are extremely diverse, Chicago, they may feel very comfortable diagnosing skin conditions that in darker skin types, whereas people who trained in schools or residencies that may not have been as diverse, and not to their own fault, just literally you see the patients that you see, so you really have to go out of your way to learn more about how skin conditions present in darker skin types. The other thing I wanted to mention, though, you mentioned textbooks. That's a big issue. And there was a study that looked at the number of skin of color patients represented in textbooks over 20 years, and they found that it didn't change. And in one textbook, it actually went down. So that's an area where there's a lot of room for improvement. The good news is there are a lot of new textbooks coming out showing skin conditions specifically in darker skin types so that we have better, at least textbook academic representation of what different skin conditions look like in all skin types.